Good afternoon, I'm Peter Matheson Gay. I'm at the Lions Health Festival.
I'm Kranich, I'm from AbbVie, and I'm an activist, and I joined the health company 3 years ago, and that's why I'm here.
The type of communications that patients resonate with are the communications that are real, that actually mean something to them. It's all about tone and language and approach, and not only is the package itself important with what you're saying, but how you say it and the channels that you need to deliver it on. So one of the things that we were talking about today was that we need to be using social. We need to be getting in front of patients where they're consuming information and in a package that is a good way for people to consume information.
And then the second step comes that if you want to provide an information, the patient has to believe you. And that means you have to put a lot of energy in trust building. And trust building does not come in a half-year business plan. So that is really a big change in the industry, that you have to have a long-term commitment to the patient groups, so they have the time to start trusting you, and that you really show your engagement, that you really care and really want to make the difference. Yeah, so it's all in the really, actually.
Yes, it's not just coming in and out. It's about a sustained approach, and then communicating them in the way that they want to be communicated to. The industry has some challenges, of course, from a regulatory and legal perspective, engaging, directly with patients. I mean, it's just, you can't do it. So we have to find ways that use the social platforms to be able to have these conversations regardless, right? We just have to find a way to do it.
Yeah, that's true. Because I mean, it's hard. I mean, if you have a conversation like we two have a conversation, yeah, I mean, I have to speak for a billion dollar company, so I cannot say my personal opinion. But my patients in Facebook, they can do that. So we have to find a way. And I think one way to do is to interact very closely to VIPs, to very important patients, yeah. Very informed patients, sorry, and they can speak for you. They can do that, and they are also a good trust point, because if the patient trusts you, yeah, then there's something kind of proof point for the company too. To say, this patient is very informed. He's in the field for 15 years. If he talks with AbbVie, probably I can listen to them. You cannot buy that.
The other opportunity is, of course, to create an environment or an ecosystem where the conversations can happen organically. So not necessarily that they're driving the conversations, but you facilitate the opportunity for the conversations to happen. It goes a long way from a transparency and trust perspective. When it comes to things not going your way on social, that's an impact or a byproduct of being in social. So either you go into the conversation, or you don't go into the conversation happens without you. And so what our counsel always is in a thoughtful and meaningful and relevant way, get involved in the conversation and be prepared to respond if other things come up, because at least then you're being responsive, you're being out there, you're giving some one-on-one direction to people that are talking about your company.
Yeah, and if you have a problem or issue on social media, I mean, the first thing I tell to my colleagues is that's a proof point that we have an important issue, because otherwise there would nobody speaking against us. The second thing is that is good, because now we are in the middle of the discussion, and that is just like at home if you have a quarrel with your wife, yeah? I mean, you have to stand your point and get through it and find a solution for that. And actually that is what pharma wants. So instead of being afraid of the conflict, I sometimes tell my people to invite the conflict and make something out of it.
I think the Lions Health Festival was an absolutely paramount idea. It is something, we have different rules, we have different things that we find important that get lost in the larger festival. We need a forum to be able to share ideas and to really have thoughtful, creative dialogue about what's going on in our industry. And Lions Health is answering that call, and I think it's a very important venue, not just from an awards perspective, but we're getting a lot out of the seminars, a lot out of like what people are sharing, and that's what we've missed as an industry, as a global industry, and I think that it's filling a void.
Mm-hmm. No, it's really super. It's a fantastic idea to be here. It's my first day. I already have 2 very concrete ideas. I'm gonna walk my team on Monday and tell them what I found out. I'm very inspired. It's super.